overview with a specific to pandemic on the occupational health and safety. Everybody know that COVID-19 is not a new thing now, because everybody knows and people have been experiencing this for last 1 year, close to 1 year. And I would say, I mean, the positive side of the COVID-19, what I had noticed, that it was evident that when the people were at home, they were confined to home, the nature were doing its process religiously. And we had spent crores of rupees to clean the Ganges, but nothing happened. But when the human creature were inside the home, everything gets settled. Nature has put a slap on our face and made it evident that, boss, we don't need you, you need us. Because all the rivers in 3 months' time were clean without any cost. The ozone layer was recovered 100%. Environment was very clean. Now, other side, we will talk about the human being, the people, where this occupational health and safety comes, where the people were working from home. Specifically to the IT industry, they were able to work from home, but other industries, yes, they have, the R2 has already happened. So in view of that, I would request Mr. Murli to share his views on the criticality of occupational health and safety and sustainability specific to the pandemic. Mr. Murli, your thoughts, please. Murli sir, you are on mute. You are on mute, yeah.
Very good evening to all of you. Thank you very much for joining the session. Based on the topic, I will stick only to the topic very close, because it's late hour in India and other related places. It is about occupational health and safety, which is not new to us. For decades, we have been practicing. But the prime focus is on what is the impact of COVID-19 on occupational health and safety. We have been practicing based on various standards, various guidelines, various regulations, the occupational health and safety, wherever the workers are there, wherever the employees are there, wherever mass gatherings are there. From that angle, if we see, till the start of COVID-19, way back in the end of 2019, things were all normal. We had regulations. But after 2019, there is a need to focus on this pandemic-related issues on occupational health and safety, because that is the topic of today's seminar. The focus here primarily is on how, first point is from OSAS 18,001 to ISO 45,001, how migration is taking place. The organizations have planning on migration for quite long. We have just 6 months left for migration to be effected, because 18,001 will be formally retired by September 2021. Having said that, all the organizations, if you see, whether it is migration or fresh implementation into ISO 45,001 occupational health and safety, which was published in 2018, all of us are focusing generally on implementation, getting certified, getting documentation, etc. Now, there is an additional burden in terms of addressing COVID-19, because it's related to workers' ill health and prevention of injury, the reduction of injury, minimizing of injury. So where do we go in terms of any sort of guidance limited to occupational health and safety? From that perspective, if you see, ISO recently has published ISO 45,005, 45,005, that was released just 2 months back, December 2020. It addresses exclusively on occupational health and safety, the guidelines in managing the COVID-19. I would see that it's one of the latest or very few ISO standards which is addressed so fast in terms of COVID-19, although global organizations such as WHO, ILO, EU, OSHA, etc., they have addressed. But for an ISO standard, COVID-19, this is the first time I've seen in my career. if you see ISO 45005, primarily it's not a requirement standard. With the 3.3 billion global workforce around, and we have ISO 45001, now we have ISO 45005 released 2 months back to supplement it to a guide about how you will manage COVID-19. The standard, very quickly, I'll go to the standard very high level. It's a general guideline standard for safe working during COVID-19 pandemic period. And it has about 14 plus clauses. Very importantly, it addresses the risk related to COVID-19 almost in the entire standard as a whole. Almost in every sub-clause, multiple times risk is addressed. And risk is addressed even in emergency preparedness and response as well. And most of the areas it covers in 45005 is typically about areas of working from home, working in other people's homes, working in multiple locations or mobile workplaces, and suspected or confirmed cases of COVID-19. I mean, covering managing the illness in a workplace, or workers at home, or mobile settings. You know, there are a lot of workers who travel for a couple of days or weeks on behalf of the organizations, how they might get impacted by COVID-19. And also this standard 45005 provides guidelines on testing, contractor tracing, and also quarantine. And very importantly, the psychological health and well-being. Psychological health and well-being, I suppose this is one of the first standards in the recent times, which is addressing, apart from physical health. You know, in an industry such as construction industry, petrochemical, cement factories, the airports, and other places where workers are working in terms of even construction of roads and bridges, physical ill health and physical well-being was taken care of more. Now, this standard started addressing the psychosocial impact of workers. The last 1 year, you know how it has impacted the workers all along, whether it is managerial workers or non-managerial workers. From that perspective, there is another standard coming up. Hold on your horses. In another couple of months or so, there is another standard coming up called ISO 45003 that is likely to be released in the end of this quarter or early next quarter. That particular standard, it's in final draft stage, ISO 45003 2021. It addresses typically the psychological health and safety at work, which has been almost ignored all these days. We just address people who have COVID-19, treat them clinically, and then get back to work because things must move on. It provides guidelines on managing psychosocial risks as well, which has primarily been extracted from PRIMA EF, that is Psychological Risk Management European Framework, which is a research project funded by European Union, and also PAS, Publicly Available Specification 1010 2011 version, which is actually, again, World Health Organization and University of Nottingham collaboration, but facilitated by BSI. In other words, now occupational health and safety need not restrict or limit its focus only towards a physical ill health and injury. From now on, even psychological and psychosocial risks, psychosocial ill health will also be addressed from these two standards. There are various other standards from ISO and even Z Canada, etc., but they are also supplementary to the occupational health, limiting to and related to COVID-19. Thank you. Back to you, Mr. Praveen. Any question, any query you want me to further elaborate on anything? I'm ready to.
Thank you, Mr. Mully. Now, very specific information on ISO 45005 and ISO 45003. Fantastic.
Thank you.
Coming to Mr. Beda. Mr. Beda, we just want to understand from you on the little overview of OHS sustainability, and I would like you to touch upon on the emergency preparedness during pandemic.
Yeah, hi all. Thank you, Mr. Praveen. Thank you, Mr. Morley.
Hi, hello.
Glad to be here. It was actually fantastic summit until now, and we hope finish this summit like it's starting. So, sustainability in the COVID-19 and speaking with the emergency preparedness. I think first of all, we need to re-identify the hazards, because we will need, we have new control measures, we have new regulations, we have new obligations, whether it's internationally or based on the authority in each country. So first of all, we will need to re-identify the hazards. We need to reassess the risks within our workplace. We will need to know how much we have contacts between people, how much, how many, or the numbers of people within the workplace. Emergency, speaking specifically in emergency preparedness, we need to identify new emergency preparedness, which is suspected or confirmed COVID cases within the workplace. How we can deal with this, with these cases? How we can identify it? What we have to do in case of identified. So this is a new emergency preparedness need to be implemented within the workplace. Second, we need to re-identify the hazards. I said that before because of one reasons. For example, in the case of fire or explosions, people will need to be evacuated. How many people we have in the place? The number of the people. Maybe if we didn't provide new resources, if we didn't provide a new plan, or if we didn't revise the plan, that will make a very contact or a very direct contact within the people, within the employee in the workplace. So we'll need to re-plan and revise our plan in that cases. This is in brief regarding the emergency preparedness maybe, and Mr. Nitin can add more about this.
Okay, thank you, Mr. Vedar. We understand the identification of suspect, identification of hazards, and alternate plan. These are three things I think you mentioned. I remember Mr. Murli had shared a document with me where the ILO, the centenary declaration for the future of work, adopted in 2019. They had it was declared in that safe and healthy working conditions are fundamental for decent work. So considering the COVID-19 situation with fatalities in millions, I think the world is reviewing its method of living and carrying out business. So, and he was talking about the psychological and psychosocial impact. Now, coming to Mr. Saibal, I just wanted to understand your views on the occupational health and safety and sustainability for this critical overview on pandemic. Mr. Saibal, please. Thank you.
Thank you very much, Mr. Praveen. Good evening here in India to all of the participants and the panelists. So at the end, we are giving a light to the occupational health and safety of the workplace. Safety and health is oftenly underemphasized or overlooked completely or partially by the organizations. And the health and safety turn the health and safety into sustainability using the concepts of the either environmental sustainability and social sustainability, rather than taking it as an integrated vision of the sustainable outcomes. The different phases of the sustainable is the long-term planning, the corporate responsibility, the opportunity, hello?
Yes, sir, we are hearing you.
Oh, that screen has been, yeah. So we are here to discuss the risk landscape on the view of occupational health and safety beyond COVID-19. Let me start with the global risk. What should we be concerned about? The global risk. In my opinion, the top risks most likely to occur in the next couple of years after this pandemic situation, due to either COVID-19 and the post-COVID-19 scenario perspectives. It may be the global governance gaps. Secondly, that is fiscal crisis. Underinvestment of the infrastructures, the chronic diseases, and the further fall in the asset prices of the organizations. You all know that risks are so difficult to predict, such as COVID-19. I am giving you the two examples of the risk. Just over 10 years ago in 2010, one massive flood occurs in the Thailand, led to the global shortage of the hard disk. It is something that we hadn't been prepared for. And it affects, the flood in Thailand affects globally. Another example is in 2016, 5 years ago, that in Germany, the historical low water level in Rhine River causes the 18% reduction in the cargo transport, created a shortage of the raw material in the Germany, which affects lower industrial production and increase the cost globally. Now, I will give a light to the uncertain features, how to improve the monitoring on major risk. The risk analysis need to be aggregated so that you get the common risks overview on you. And which risks are the most important to monitor closely and which should be prioritized in 2021. The risk landscape is very complex to assess. In this pandemic, it is still very much in forefront. So what we should do? In the COVID-19 situation, in the industry, the collection of COVID-19 data and resources requests, the aggregation and visualization of data, resource management to assign and track the medical equipments, automated reporting of the pandemic data to the authority. So this can be done by some techniques. These all techniques are the top-down analysis and graphical representation. In this modern industry, the fault tree analysis, event tree analysis, cost consequence analysis, and MOSER, it is method organized systematic analysis of risk, can be done. As I have said that this is top-down analysis scheme, that every aspect of hazard identification due to pandemic or any type of risk can be addressed by these techniques. All this fault tree, event tree, cost consequences analysis, and MOSER are the 6-stage assessment. There is definition of the scope, familiarization with the scope and design and function, identification of the top event, then consequent construction of the tree analysis, and the tree analysis of the tree constructed and documentation of the result. That's all from my side regarding health and safety perspectives due to pandemic the organization are facing. Thank you very much.
Thank you, Mr. Saibal. We heard a lot of technical terminologies from you, and I hope our audience is going to like it and going to learn from this. Next, I'll come to Nitin. Nitin, we just want your overview on the OHS and sustainability, and I want you to touch upon the emergency preparedness from your part. Thank you.
Yeah. Thank you, Mr. Praveen. I would focus more on the practical aspect of emergency management, because we had learned a lot throughout the day with regards to the different policies and procedures. Of course, I represent Bangalore Airport, and we are compliant with various standards of ISO, including business continuity and at the same time OHS standard also. Now, COVID had hit badly to all the industry. Airport aviation industry was no difference to that. Now, aviation industry was hit little more than many other industries. And the reason was because we were in the business of connecting people. And COVID was all about distancing. So that was the reason why we were badly affected. But there were organizations which were more resilient, and they came out successful out of this whole process. Or at times, our emergency preparedness was very much important. Now, why was it so important? Why there was a transformation in the way we look at emergency at the airport? I'll just talk on that for a moment. Now, traditionally, when we are talking about emergency management, we were focusing on aircraft crash. If Mr. Soham is there, he can present the slide so that audience can see also on the screen. Mr. Soham, if it is possible. Yes. So I was talking about traditionally we were talking about aircraft crash as a major emergency. And the whole design of emergency response plan was focused towards the aircraft crash. But with COVID, we have realized that there are many other components of emergency management which are equally or more important. That is chemical, biological emergencies, or radiological, or nuclear emergencies. So now the focus has changed. Now, talking about how we did it at Bangalore Airport. Well, we had a well-defined incident management system. Now, in that incident management system, there was a top body which was making a strategic decision making, which involved our managing director and his team members. Then we had a tactical decision making body where we had the war group members. So what we did was, immediately when we sensed that crises are increasing and it is going to have an impact over the organization, we formed a war group which included 30 representatives from different departments of the organization. Now, they were responsible for understanding the policies, getting involved in the framing of the policies, at the same time facilitating the application of it, or at the operational level implementation of those policies. Now, the strategic decision making body used to meet during COVID season till very recently every day at 9 o'clock. They used to make strategic decisions. Now, these decisions were implemented at tactical decision making bodies meeting, which was at 12 o'clock. So we have a war group meeting at 12 o'clock, and how efficiently the policies are implemented, that was screened at 5 o'clock again with the meeting of a strategic decision making body. And there was a thread which was connecting all these bodies. That was the head of crisis management. So he was part of the strategic decision making body. At the same time, he was part of the war group also. Now, the beauty about this particular model was, this functional specialist was given tremendous powers. He was not just given power with regards to disaster management or crisis management, but some administrative powers were also given. Some financial powers were also given. And that was the reason why we were able to implement certain administrative decisions immediately. For example, reducing the capacity of the transportation, employee transportation, by 50%. stopping the canteen facility, and changing the mode by giving take-home facilities, changing the menu of which was served. But you are going to the next slide. Please be on the first slide, please. I will tell you when to move forward. Thank you. Now, we were talking about the second component, about the financial powers. So when this financial power was handed over, we formed a separate COVID fund or COVID account. Now, this was the reason why we could immediately procure what was required, and there was no shortage of PPE, no equipment shortage was there, because we knew, we could sense that there'll be a shortage here. So we procured it in advance. So that was possible because we had this particular flexible system. Now, with this, we moved on to a quick decision making based on the rapid developing scenario. During the initial phases, we were not knowing what COVID is going to impact us. But we learned from Chinese experiments. We learned what safety measures they are taking. We learned from something from Singapore. And then later on, we developed our own system. So that is how this particular whole process helped. And then whenever we were implementing new strategies, we knew that there will be a gap. We knew that we might go wrong. So there was a continuous monitoring which was going on. Now this helped us to wider element of adaptability towards the evolving scenario. And then whatever we had learned, we did not limit it to our own organization. We took it to the entire ecosystem. Airlines, ground handling agencies, concessionaires, transporters, everybody. So for that, we had a stakeholder group. So in war group, we had a representatives who would talk to this stakeholders group, convey the message, philosophy, techniques, processes, and ensure that they follow it. Then we formed certain task groups. Task force was specific for different tasks. For example, contact tracing. We had a task force. Now the responsibility of the contact tracing task force was to ensure that, okay, who is positive, who were the first contacts, who were second contacts, who is to be isolated, for how many days, are they following it properly, are they admitted to the hospitals, and to review the whole process. Well, after moving from the contact tracing, let me share with you. Can we move to the next slide? Let me now share with you what were the uniqueness about our approach. Well, can we move to the next slide, please, if possible? Okay. Now, the good part about the whole uniqueness about the approach was the involvement of the entire organization. Our managing director gave a mantra: accept, adapt, and advance. And now this mantra was given and everybody followed it. Why was it possible? Because our managing director used to talk with all of us on a regular basis, sometimes by email or by recorded videos. And it was so true that when we had our first case of COVID in our organization, he came forward and said, yes, there is a case of COVID positive, and we are providing all necessary support. And he also ensured that nobody is going to lose your jobs. Your salary cut would be the last option which I would opt for. That gave us an immense confidence that yes, the organization is with us. Delegation of power was helped us in adapting ourselves to the evolving scenarios. We were early starters. In the month of January 24th, we had a CBR and training program, and in that I conducted a tabletop exercise which was talking about COVID management. So if a flight with COVID patients reach out to Bangalore airport, how are we going to deal with it? Our training program started in the month of February first week also. And I still remember in my first course, there were just 2 people there, and the third person was the person who came to fix the computer, and I said, you please sit for the course. And the last physical training when we conducted, it was house full and there were 30 people standing in the room. So well, over a period of time, the awareness across the organization and the ecosystem grew about it. We were always talking to our customers. Because there were so many circulars which were coming, we were trying to make it a little easier for the passengers at large, and we were sharing it through social media to all our customers so that they can understand those circulars and change themselves accordingly. We were always assuring everybody that, or especially our consumers or customers or interested parties, that we are here with you. It was the airlines community, it was the concessionaires, it was the cargo operators, or at the same time, the community at large. Because for that, we started a CSR program where Namami, where we served food to around 7,000 people on a daily basis, which were in the surrounding community. So that is from me at this point in time. Maybe I'll add more when the questions are coming. Thank you so much, Praveen ji, for giving me an opportunity. Thank you.
Thank you, Nitin. I think this is a real good case study where emergency preparedness strategy was showcased by BIL of the aircraft crash, and I like the tagline, "We are here for you." Fantastic. I know we are in 2021, but there are many companies which are still on OSHA's 18,001. They have not even migrated, or they must be planning to migrate to ISO 45,001 because OSHA's is there till it's validated till September 2021. Mr. Murli, I know there are a lot of changes between 18,001 and 45,001, like on OHS performance, PDC approach, hazardous identification. These are already there in both. Yeah. I just wanted to know from you, like, what are the major changes between 18,001 and 45,001?
Sure, thank you. Well, while OSHA's 18,001 laid the foundation for occupational health and safety management system, which was adopted by ISO in 2018, has more optimized the functionalities addressing the requirements related to addressing workers' ill health and injury. This is number one. Plus, it also enables more of consultation and participation of workers, ISO 45,001. In other words, ISO 45,001, I would use the terminology of an advanced version of OSHA's 18,001. Coming to the specific and salient gap or delta between these two standards, or some of them, I can list it out. Both available or non-available in both the standards. In both the standards, typically the process approach and then the PDC cycle that is known as a Deming cycle is existing in both the standards. Immediately, there are two new clauses in ISO 45,001 right from the start of the standard in class 4. That is, in class 4.1, it addresses 45,001 addresses about external and internal issues, which the OSHA does not address at all in any area. Now, if you see that COVID-19 is an external issue, ISO 45,001 addresses it right in the first clause itself, in clause number 4.1. And it doesn't stop only in external issues, and internal issues do not stop only in clause number 4.1. They also radiate towards, in terms of interrelationship, into clause number 4.3, that is scope of the OHSMS, and 6.1.1 in terms of action to address risks and opportunities, particularly hazard identification and assessment of risks. And also finally 9.3 management review, where the management is required to review what is the trend in changes of external and internal issues. In other words, external and internal issues is so strong, it starts from clause number 4.1 at the start and goes up to the 9.3 at the last stage. Even the top management has to review. This is one salient feature. The another new clause in ISO 45,001, which was not very predominantly available in OSHA, is clause number 4.2 about interested parties, needs and expectations of interested parties, of which needs and expectations it has an impact on the compliance obligations. And it's not addressed only in clause number 4.2 alone. It goes out in terms of from 4.2, it goes towards OHSMS policy, it goes towards consultation and participation of workers, hazard identification and assessment of risk, 7.4.1 communication, and then 8.4.2 contractors. See, 4.2, there is interested parties in 45,001 is addressing very importantly on procurement, outsourcing and contractors, whereas OSHA's 18,001 does not address it. You know that contractors and outsourcing and procurement agencies, they're all our interested parties. They are going to have a solid impact on COVID-19 in terms of managing the supplier contract, where COVID-19 related specifications must be mentioned, and incoming material which may carry COVID-19 related infections. The persons who are coming to deliver may have COVID infections. In other words, the interested party, that's a new clause in 45,001, addresses even internal audits. That is, if anyone sees the standard 45,001, interested party addresses all this. But one of the finest things in OSHA's 18,001 is in the normative references at the start itself, it gives references of how to implement OSHAs. And also it gives guidelines from ILO, International Labour Organization. And if we go on down, yeah, both the standards address a hierarchy of controls, so typically 5 of them, which last one ending with the PPEs. As far as objectives are concerned, we know that any management system, not alone, only OHS, objectives are required. Where we are going, show me the numbers, KPIs. It is there in both the standards, but 45,001 addresses how you will plan to achieve the objectives. That is what is a very salient feature in ISO 45,000. As far as consultation and participation of workers, there is the heart of OHSMS. So we all know that occupational health and safety primarily revolves around workers. Workers, engaging workers in terms of consultation. Prior to doing anything, consult to the workers. The next, participation. While doing or executing it, make the workers participate. So throughout the standard, consultation, participation of workers is there in both the standards, but ISO 45,001 addresses more on participation and consultation of workers. In such fashions, if you see even internal audits, OSHA is very good in terms of addressing any audit program. All of us know audit program is a set of arrangements of carrying audit, various audit plans in a specific period. OSHA is something unique in terms of it addresses. Your audit programs will consider even the results of risk assessments of the organization's activities, which ISO 45,001 does not have. Of course, ISO 45,000 addresses how the audit program will be considered in terms of importance of the processes, findings of the previous audits, criticality of the processes, etc. So these are the main features. And OSHA's 18,001 in class number 4.5.3.2, it talks about preventive action. In ISO 45,001, in ISO 9001, ISO 14,001, recent standards, none of them talk about preventive action because ISO is very clear and there is no need to take any preventive action because you are addressing risk very effectively. So if you address risk, even in personal life, business life, social life, if you address risk, there is no need for preventive action. So these are all the major salient features in these two standards. I would reiterate that OSHA's 18,000 laid a strong foundation for ISO 45,000 to be this glorious and this powerful. Plus ISO 45,000, now 45,001 gives rise to multiple further standards such as I mentioned earlier, ISO 45,005, ISO 45,003, which is coming in next 2 or 3 months. And there is also a British standard, BS 45,002, Part 2. It addresses only risks and opportunities related to occupational health and safety. Last one, BS 45,002, Part 3. It addresses only about occupational health related incident investigation. Similarly, there are a lot many standards apart from ISO, from national bodies, national members or country members of ISO, who have created a lot many standards such as Canada, BS, British Standards Institution, etc. Any queries, please? Thank you.
Thank you.
Welcome.
Thank you, Mr. Murli. I think this is nicely elaborated. There are a lot of changes between 18,001 and 45,001. The mainly predicts about like the involvement and engagement of the leadership and the employees and workers. So they feel that they are also part of the health and safety culture and the journey. Saibal sir, just wanted to understand how does the migration work with the key changes in the implementation between 18,001 and 45,001 and how it has affected on the focus during the pandemic?
Well, Mr. Murli sir has explained the migration of 18,000 to 45,000 very clearly. Thanks. And the implementation, as Murli sir told, that the clause number 4.1, 4.2, and even in the that risks assessment and 6.1.1 and 6.1.2, the risks assessment and the mitigation and action to address the risks and opportunities, is the prime actor in 45,000. The organization who want to migrate to 18,001 to 45,001, they have to keep on stress and very focused on this for clause number 4.1, 4.2, and 6.1 as well.
Okay, thank you, sir.
Thank you, sir.
Whether just want to check how many aspects of emergency preparedness you would consider as clause 8.2?
Yeah. Aspects, we have to consider many aspects during the COVID, actually. Starting from, as I said before, from prepare for the new, any suspect or confirmed COVID. Going through the training, we have to make a new training for the emergency preparedness, for the new emergency preparedness. We have to train that people. We have to make that we are provision the first aider. We have to provide a new training for the first aider, how to deal with any suspect or confirmed COVID cases within the workplace. This is one. Second, we have to ensure that these first aid can deal with any injury within the workplace, because in COVID, in the COVID pandemic, we cannot make any direct contact between the injury person and the first aider. We have to avoid that as much as we can. So we have to ensure that this first aider know what to do, how to do, and know how to assess the cases in that time. Also, we have to ensure that we are practice this emergency preparedness, which is very difficult, as we already know. We need to ensure that we are minimize the direct contact, we are minimize the gathering of the people within the COVID. But practicing of emergency preparedness, new emergency preparedness, is very critical and very important during the COVID. Also, the communication. This is very important aspects we need to consider, because I said when always within the COVID, we miss the variable communication. We really miss that, the variable communication. Mostly we are dealing with non-verbal communication. We're dealing with the emails and blah blah, such of these non-verbal communication types. But we need somehow variable communication, especially during the drills, for example. We need that variable communication. We need to ensure that these people with different level of educations understand how to deal in case of something happens. This is how the most important aspects, as I can see in the COVID, and most aspects that companies should be considered about it, because it's a critical way to deal of such aspects. We need to implement it. It's hard to implement it, but we need to ensure that all people feeling safe, all people have or the company or the organization provide the resources of these employees. So this is, from my opinion, this is such aspects we can or the company, the organization has to take in account.
Correct. You rightly said, because emergency preparedness is directly related to people, and people, when we say, it's like all emotions and psychology. So we'll have to give them that comfort so that they understand what kind of preparedness is there. Saibal sir, you wanted to say something?
Yes, that in this view that Badr has told that emergency preparedness. Am I audible, sir?
Yes.
Yeah,
Yes, sir,
yes,
yes.
please.
Okay,
Yes,
thank you,
yes.
thank you. So as I told, that risk landscape is a very complex to assess, and some of the leading industry experts listed the infectious disease nowadays within the 10 major risk and major risks to be addressed very carefully. So this COVID-19 situation is a very much infectious disease, and we have to made a strong and concrete emergency plan to face not only this COVID-19, any type of threats on the human health, and not only the worker, the entire community, to address and to overcome this pandemic situation in either in COVID or on any type of critical disease. Thank you.
Thank you, sir. Nitin, just want to check. You had elaborated how you had managed that the aircraft crash. The example you gave. I just want to understand, how does the emergency preparedness contribute to the organizational well-being? Like, how you would have felt that?
Well, thank you. Now, since we're talking about OSHA standard, let me start on with the workers, what impact it had or what kind of policies were brought out. Then I'll shift to the business model. And finally, would like to share what are the good take homes or what was a good side of COVID for the industry. Yeah. To start on with, well, we ensured that the physical health as well as mental health is taken care of. Now, how did we do that? So the vitamin tablets were provided to the employees. Secondly, we had the counseling session. We had engaged a psychologist who and we had advertised it throughout the organization, and people who feel down could call him and get information and update from him. We had a 24/7 helpline also. Now, apart from this, I told you the managing director passed on the message, but it was not limited to him. It was the HR which was also involved, and the departmental HODs also were involved. Like there was a chai with a HOD, and then HOD will have an informal talk with the employees. Now, similar was we had some motivational speakers. So we used to bring those, and they used to talk with our employees. Then we used to talk about success stories of the industry. So the CEOs of different companies, they used to come, and then we used to have a webinar, and they used to share their success experiences. Similarly, the top management also used to talk and have an informal kind of a talk with the employees, so they could show the other side of it. So that actually built them, mentally as well as physically, to ensure that they are ready for the challenge. Now, apart from that, we had a special insurance cover, additional insurance cover because of COVID of 20 lakhs for the employees. That also insured them. And of course, other benefits were taken care of. Now, talking about this aspect, let me talk about a business model. Now, because of the crisis, the passengers were not there in the terminals. So the flights were empty. Now, then we realized that this is a time where cargo is picking up. Now, cargo, because of medicine export or because of the export of garments and perishables. Now this was so much of a big success story that in the month of September 2020, we were, largest airport from where the perishables were exported, or we could increase our business compared to the year before with regards to, carrying of the export goods from Bangalore airport. So this was how it changed. Now, did we limit ourselves to this? No. We realize that the reality is that there is a possible threat to the business. And then we said, let us start with an idea bank. We talked to the employees and said, okay, you form the teams and you come up with these successful business models. Employees voluntarily participated. More than 100 ideas were there. We filtered it and 6 ideas were selected out of which, and companies committed to ensure that these startups are supported financially as well as all other resources, and those people who are going to run the product, run these ideas, will get the share also in the profits from 5 to 15%. So that is how we came up with new 6 business ideas, which we are working on. Talking about this, now let me talk about what is an opportunity which is looking forward for a business. Well, there were many of us who never used to know how to use the web platform, how to use Microsoft Word. Now we have become conversant with it. Similarly, we have realized that, well, with COVID, we need to save money. And to save money, we need to bring in efficiency within the system. So wherever there was excess manpower, we tried to ensure that the manpower are balanced. Where there were 2 departments, probably one would be more efficient, we did that. Wherever there was a talent which could be utilized better in some other place, all those things were done. And that is how we are working. We're still working on it to make the organization much more resilient towards any kind of crisis. Thank you. This is from me at this point in time. Thank you.
Thank you, Nitin. Thanks for your useful insight you shared. Alvin, just wanted to check, we have time? I think we can check from the questions from the audience.
Yeah, we have some time. We can still contribute something.
Fantastic. So, Murli sir, just wanted to check if you can share some more information and guidelines on OSHA's, occupational health and safety.
Thank you very much. Thank you very much. When Mr. Badar and Mr. Nitin were talking about, typically about the emergency management, and also I want to connect the query that you asked Mr. Praveen about the delta or the difference between Virtusa and ISO 45001. One of the salient features I wanted to add is on emergency preparedness, where ISO 45001 is addressing emergency preparedness in particularly when compared to ISO Virtusa 18001 is. ISO 45001 addresses in emergency preparedness only I'm referring to now. It addresses what Virtusa 18001 did not address. I mean, 45001 addresses providing training related to emergency preparedness, and also planning and exercising the responsive capability of the organization towards emergency preparedness. Yeah, I have the plans for emergency preparedness, but I don't have the capability to exercise. Then there is a big flaw and the gap. And very importantly, the next one is under class number 8.2D, D for Detroit. The 45001 standard is much better in terms of evaluating the emergency preparedness and response that you planned and you are delivering, which Virtusa 18001 does not address. And very importantly, you need to communicate and also provide the relevant information to workers on emergency preparedness, which 45000 addresses very clearly. Yeah, communication is there mentioned in Virtusa 18001, but in 45001 it is very explicit and very clear. And very importantly, in clause number 8.2.G, ISO 45001 addresses when compared to 18001 in taking into account the needs and expectations of relevant parties. It's very important in terms of emergency preparedness. Assume I have an insurer as an interested party or my investor. They would like to know how you are taking emergency preparedness. When you do a mock drill, you may invite them and then make them stand there. Mr. Insurer, whatever the amount we have insured, you see what sort of a response we take. So this sort of assurance also we need to give to the appropriate interested parties, which is highlighted in ISO 45001. Lastly, the major difference between 18001, that is Virtusa and OHSMS, is 18001 insists on sort of a procedures, how you will do emergency preparedness and response, whereas 45001 indicates We don't want any procedure or indication. Show me the record that you carried out and implemented emergency preparedness. That's the difference between maintained documented information and retained documented information. From that perspective, I wanted to add more on emergency preparedness related difference between OSHAs and OHS. Thank you, Praveen.
Thank you, Mr. Mulli. Mr. Saibal, you want to add something to this?
Praveen, if you allow, I'd like to add something later on. If you allow me, I'll add something on to this.
Yeah.
Mr. Saibal.
Yes, sir.
Yeah, you wanted to add something. Please carry on.
No. I told that it is okay, and next speaker is waiting. I think so. So, Madhu sir, you please give us some light.
Okay, Praveen, am I allowed to add to something on this panel?
Yes, please, Mr. Madhu.
All our learned panelists have really.
Alvin mentioned that we have time, so I said, why not utilize it?
Yeah. Okay. I'm keeping my video off because there is some bandwidth problem, so I'm just keeping it off. Otherwise, the voice will not be clear and this thing. So while we are talking about occupational health and safety, sustainability, emergency planning, and whatnot, 45001, 45005, and we are talking about how this ISO compliance is relevant to the pandemic or to the human capital. So I would like to add 2 or 3 points from the point of view of the compliance of ISO, impact of ISO. Is there any specific ISO on our human capital? So because human capital is basically human resource department function, which is managing the show everywhere. So whether it is occupational health and safety, mental health, or physical health. So I'm not sure how many organizations do carry out the ergonomics study. Now, when we say ergonomic study, it is a study of a human body to develop such kind of systems that allow people to work in different conditions for optimal efficiency, safety, and comfort. Now, I don't know how many organizations talk about it, like specifically when we are talking about working from home during this COVID. This ergonomic, like the condition in which we are sitting, we are working virtually, providing the services, and the entire day the body just moves here and there, but it does not move physically. Our mind is working here and there. So how many organizations are talking about ergonomic study? I'm not aware of it. I think this ergonomic point of view definitely is going to contribute to the occupational health and safety. Occupational health and safety is for whom? For the human capital. Okay. Now, the other point which I want to add is there is a separate ISO, which is 3414 of 2018, which is on human resource management guidelines for internal and external human capital reporting. Now, the objective of this guideline document from the ISO is to consider and to make transparent the human capital contribution to the organization in order to support sustainability of the workforce. Now, this document is applicable to all organizations, all types of organization, all size, all nature, whether in public, private, or voluntary sector, and or a not-for-profit organization. Now, this document talks about compliance analysis, cost, diversity, leadership, organization culture, organization health, safety, well-being, productivity.
Mr. Madhu, we are losing your voice. Okay. I think Mr. Mulli want to add on ergonomics.
All right, thank you very much. I would like to add what Mr. Madhu was elaborating. Ergonomics, generally we understand in common terminology across globe, it's related to our working posture, our physical health, so that we are anatomically and clinically we are much better. Whereas ergonomics is much beyond. In other words, it's a total, fully scientific discipline. Ergonomics is primarily a combination of many disciplines or areas such as even psychology, sociology, engineering, bioengineering, and biomechanics, how our bodies move, and also the industrial design where your biology meets the technology, in terms of your seeing the computer, sitting posture, walking down in the mosaic floor, which is slippery, and climbing down, climbing up, etc., and also driving. Also the physiology that is of the body and anthropometry. Anthropometry is typically the measurements that you need to keep between the body and the machine. Interaction designs and also visual designs, what you need to have so that it is pleasing for the eyes, so that the brain does not get overrated and get heated up. And very importantly, the user experience. Now today, we take this example, this summit, we have been here since morning. It should not be affecting us if we continually see the laptop or observe this webinar or the seminar for more than 6 hours, 4 hours, 8 hours continuously. So what are the user designs, and finally user interface design between me and the machine? Is there any medium that can come to reduce the ergonomic diseffect? But what are the effects, positive effects that we derive or look forward from ergonomics is, number one is it should primarily reduce the human error. And also, obviously, the business, it should increase productivity, it should go up, and also ensure the safety and comfort of the persons who are operating or working upon for the organization. It's primarily the relationship between the human and the thing of interest, whether I'm driving or climbing for the organization, or whether I'm printing invoices or seeing the machine and making coding. So it should be a smooth and positive interaction for both human beings and the things of interest. This is ergonomics.
Yeah. That's what I wanted to bring it out in this August panel.
Okay,
and I just thought about it that was the idea. And then if we can focus on, because we are all leaders, and being you, the trainer, and the industry leaders are sitting here out here. So, and if we can really focus on this ISO compliance, when we say today is the knowledge sharing ISO. So when we are talking about ISO 45001 migration from 80001, or we spoke about ISO 31000 risk management, we talked about information security management system 27000, 22301 business continuity management, whatnot, we have spoken about it. But the main and important aspect remains, how do we actually take care of this people, process, and technology? Then people are important. Only process and technology cannot do anything if we don't exist, actually. And COVID has actually brought us back to our homes to spend time with our families. But actually, are we able to spend time with our families? No, we are not, because we are 24/7 available.
I agree.
At least there was a time. But yes, we are adapting to it. This is not new normal. This is abnormal, which will come back to the normal. This is what I feel. But yes. But yes, and then this ISO 31414, which is specifically related to the human resource management capital. And if we can really focus on that also, and in an integration with this occupational health and safety, it will do wonder, actually. This is my opinion. Rest, you are learning people.
Thank
can
you.
throw more light on it. This was from my side, and thank you so much for allowing me to talk.
Thank you so much for your quick bite. I just take closing comments from all the speakers, and then after that we'll check for the questions. I'll start with Mr. Saibal. Sir, any closing comments? I think you're on mute.
I am in mute because Mr. Murli was speaking. So any type of disturbance can be affected his speech.
Thank you.
Okay. Thank you very much for great topics we have discussed within our 5 panelists. And as per Mr. Madhu has said, that the human resource ISO certification is a very important for the ergonomics, as well as the Murli sir said that we are sitting here for long 8 hours. And that's physical and mental condition, ergonomics is to be taken care of. Thank you very much, sir.
Welcome, sir. Thank you.
So anyone having any questions?
Thank you, Mr. Saibal. Mr. Vedar, any closing comments?
Yeah, thank you very much for this very informative, very knowledgeable summit. I'm really proud to be here within all of you expertise, and I am one of the speakers, but I learned many things from all of you, and thank you very much. Thank you.
Well,
Thank you, Mr. Buddha.
Sir, I wanted to tell something. There is some question for Murli sir in the question box, QA box.
okay.
Sir, you can take over the
Okay, this is
QA
Murli.
question.
I'm taking up the query. I will, of course, most of us are there. There are two questions there. I will take both the questions. The first query is asking about how NEBOSH credential will help an organization in context of 45,001. First and foremost thing, positive response from me is that yes, it will add multiple values. Why and how is the one that we need to see. We'll speak a couple of minutes, just about a minute or two on 45,001 and also NEBOSH or any other models really, similar to NEBOSH. 45,001, it's primarily provides as a management system. It's not like either a quality control or quality assurance. It's a management system as an encapsulating and then almost at a top management involvement. 45,001 provides a framework, principles, and also establishing a robust OHSMS system at a comprehensive level, covering all the aspects of global OHS requirements. You would have seen this ISO 45001 was not just published by ISO by a couple of countries or a couple of consultants. More than 50 plus member countries across globe have contributed. Over a period of time, it has been iterated, reiterated, and then draft version, first draft, second draft, final draft, and then it has been published. That is why it is international standard. It also addresses strong documented information in the form of either a procedure or a report. Plus, 45,001 insists on very robust internal audits, and plus, finally, it leads to certification audit. And 45,001, you should not see it as a standalone standalone standard. All the auditing requirements required for 45,001 as a management system standard is supported by another ISO standard that is known as ISO 19011, guidelines for auditing management system standards. So if we see 45,001, it is not alone. It also comes with ISO 19011 to set the base strong platform for any other occupational health and management system related models or programs to come and go integrated along with the 45,001. NEBOSH credential is one of them. While 45,001 talks about framework and principles at a higher level in terms of building the boundaries, the fence work, and the groundwork, NEBOSH comes with the immense value in terms of on-site, practical, hands-on approach in many areas with prescriptive approach. ISO 45,000 is only a suggestive standard, not a prescriptive standard. Whereas NEBOSH has specific ways of doing things in terms of managing occupational health and safety. So both together, it's going to really add value to any organization, no doubt about it. Hope that query satisfied the person who asked that query. Thank you. Taking up the
Very
next.
nice.
Thank you, sir.
Thank you, Mr. Murli.
Thank you, sir. I'm taking up the next question. I'll first read it. Another person has two questions. One, if ISO 45001 is expensive, well, I'll come to that. If ISO 45001 is expensive, how can small scale industries will be able to migrate from BS 18001 and why? Okay. Next question. If BS 18001 was suffices an organization's requirement as per scope during this pandemic, when operation is low and revenue drastically low, is it feasible to migrate to ISO 45001 OHSMS? Very good question. This question, two questions are there. We will address one by one. The question itself starts with if ISO 45001 is expensive. I'm going a little moving out of the business experience. What I need is my requirement as an individual. What I need for my family is my requirement. So similarly, business requirement is there. If you shell out more, if you spend more, or based on your business plans at a high level, naturally, you will stand apart in your industry, in your business, even if it is a small scale industry. Assume you're a small scale industry in a particular line of business where about 15 or 20 are there in the top 20 and you are among one of them. And how you will become number one or number two. So there should be a differentiator. For that, making a differentiator, naturally money. Without money, nothing talks. There is no grammar if money is there. And naturally for all the resources who will work for ISO 45001, naturally you need to spend resources, spend on training and awareness, ensure emergency preparedness and implements in terms of fire extinguishers, sprinklers, etc. Those are available. Harnesses, see, it costs money, number one. Having said that, I wouldn't call it expensive. It depends on what you actually need. There are two ways of looking at it. One, to document and implement ISO 45001, but don't go for certification. You want a system or you want a certification. If you want both, it is expensive. If you don't want both, you don't want certification at this stage, let me implement managing and meeting the requirements of 45001. Certification I will see later when things stabilize. That could also be one of the approaches. Hope this addresses your first question. Thank you. The next question I will take. If OSHA suffices organization's requirement as per scope, during this pandemic, when operation is low and revenue is drastically low, yeah, is it feasible to migrate to 45001 OHSMS? My opinion is yes. If there is a will, there is a way. This is not philosophical talking. I am actually talking because I have enabled many organizations which has only 10 people working who were in OSHAs. We have enabled them to move to 45,000. It is a slight transition from a catamaran into a small boat. Small effort is required. Top management commitment is required. All other things will fall in line. It's the intent of your organization to stand apart in your business that, yes, we know what is occupational health and safety. On the other hand, whosoever asked the question, the other hand and others as well. If we don't move to 45,001, we don't know and we are not moving in a developed stage of where the globe is moving. If we don't go in that direction, just imagine one incident of an organization not following up or meeting the requirements of regulatory requirements, like municipalities' regulatory requirements, they indicate certain regulations. If we don't have a system, we may not follow. We may not determine what regulatory requirements are required. We will not be able to evaluate where we are following, for example, municipalities' requirements. If we don't follow, one fine day there will be an audit from the regulatory body. So there, in order to avoid failures, and also in order to move forward and develop, go forward in occupational health and safety, it's the top management which has to take the call. Yes, I want to progress, I want to forward. I should not be also ran cases. Okay, so hope this helps in your understanding. Thank you.
Sir, thank you so much. I think we are running time. Praveen, we have to wrap it up.
Yes. I'm just taking closing comments from Nitin.
I just would like to take this opportunity to thank Praveenji for the wonderful moderating of the session. Thank you, Madhusudan for inviting us, Sohamji for inviting us, and the hard work they have taken to fix all these things together and have a wonderful session. I find myself lucky to be part of this wonderful summit. Thank you so much.
Thank you.
Thank you, Nitin. Sawant, yeah, it's our honor and pleasure.
Thank you, sir. I only answered the questions. I have not given my closing comments. Can I, sir?
Yes, sir.
Please, sir.
You have to give your closing comment.
Thank you very much. I thought you will ask when you will come back. Okay. My only point to this entire summit, thank you very much for the participants. Thank you very much for the panelists and the moderators and the coordinators and the management as a whole. But one important takeaway from occupational health and safety is this ISO 45001 and OSHA 18001, what we are referring to above. Let us take ourselves back almost 1 year from now. At the end of 2019, yeah, we were implementing ISO 45001. Now we are implementing 45001. What is the difference? The difference is 1 year back, the standard was focusing on physical ill health and physical injuries. Now, in the 1 year, whatever the people have undergone sufferings in terms of loss of job, reduced salaries, stress, strain inside and outside, possible exposure to infection and possible exposure for treatment, you see multiple packets of negative factors are there. With this, we are going to implement ISO 45001. This is the reason why ISO is coming up with ISO 45003, which focuses very importantly on psychosocial factors. Psychology based on the factors that comes from the society. This is why ISO has taken pains to come up with the latest standard that we will see in 2 months or so. In other words, in addition to physical health and ill injury, mental health and health factors, mental psychological factors also need to be considered for all those who are going to implement ISO 45001 from now on, and whosoever is going to migrate from OSAS to OHMS from now on. Thank you.
Thank you, Mr. Murli. Madhuji, we have any more questions? Otherwise, then I'll sum it up.
No, please sum it up.
Okay, great. So thank you so very much, all the panelists. It was lovely hearing you. We all understand the importance of ISO knowledge for the ISO 45001, ISO 45005, ISO 45003. We had a very great, knowledgeable panelists in our session. Now it is evident that EHS is a way of life, not an audit and certification function. We have to just imbibe it in our day-to-day culture so that we all are aware every time that this is we don't need to prepare only for audit. And for the organization, I think leaders to own and aspire of safety so that people understand, and down the line we'll have to create a culture of care. Consider this pandemic or no pandemic, health and safety to be emotionally integrated with the employees and vendors and everyone, including visitors. And we need to see the steer transformation from paper to people, compliance to culture, metrics to mindset, and we have to build this health and safety infrastructure to encourage people so that R2 can happen easily. People understand what is required to be safe all the time. Thank you so very much to the audience, lovely audience. You have heard us patiently. That's it from our side, and we are signing off. Madhuji, thanks to you.
Thank you.
Thank you, Praveen, and thank you all the panelists. Thank you so much. And we are lagging behind time, but while we apologize, we have one of our speakers to present now. He was stuck up somewhere. There were some emergencies, and that's what for this ISO knowledge sharing is all about. And we have covered everything and not covered the crisis management. I'll be handing it over to Elizabeth to further take it on from there. Over to you, Elizabeth.
Thank you so much, Madhuji, and thank you to all our audience first who are still here. Really, you need a round of applause. We still have one more speaker, and thank you to the last panel. Very, very well delivered panel. I quickly move to our next speaker, who is Mr. Rohit Verma. He is a senior business continuity professional